can be completely debilitating and just cause unimaginable symptoms, and I would never ever downplay that or discount that in any way. Hey guys, so this has been a video that I've wanted to make for a while now, but it's just kind of a topic that I want to approach carefully, and I don't want to say anything that would, you know, potentially offend anyone or come across wrong, but just as kind of like a disclaimer, just remember that anything I say in this video is, you know, just my opinion, just what I've learned through my own personal medical journey and personal research. I'm not by any means any kind of professional or anything like that, so just take whatever I say with a grain of salt. And then of course, you know, form your own opinion, and it's totally okay if it's different than mine. So about 1.5 years ago, I was diagnosed with chronic Lyme disease, and I have been chronically ill for over 5 years now, and I actually was sick for about a year in high school when I was around 15 years old, which is about 10 years ago now. And in between those years, I kind of had, like, I don't know if you would call it a remission stage, where I was doing really well and wasn't having a lot of issues with my health. Throughout my journey with chronic illness, I've been diagnosed with a lot of different things. The first thing was POTS, postural orthostatic tachycardia syndrome, which is a type of dysautonomia. And that was kind of the beginning of my journey that eventually led us to different paths of treatment and diagnosis. Later, I was diagnosed with Chiari malformation, intracranial hypertension, which is increased elevated pressure surrounding the brain, tethered cord syndrome, craniocervical instability, and the spinal instability, and fusion surgery that I had. Another random thing I've had is that my jaw has been dislocated for almost 4 years now. And then there's what this video is about. I was diagnosed with Ehlers Danlos syndrome, which is a connective tissue disorder, and I was diagnosed with the hypermobile type of EDS. And so HEDS is a clinical diagnosis, meaning that there isn't a specific blood test that can be done to say you have this mutation and you have this specific disease. And I know that they're doing research right now to try and find more information about patients that have HEDS, which I think is amazing. More research needs to be done. People with HEDS are, you know, can be very severely affected, and they need help. So when I was diagnosed with HEDS, I thought that that was the answer to my health conditions. I thought that that meant that I would be sick for the rest of my life, and I thought, and when saying that, you know, I still thought that there was hope for better quality of life and less symptoms. It's not like being diagnosed with HEDS made me like lose hope to improve in my health. But it did kind of make me think, okay, like, I'm going to have these conditions probably for the rest of my life. I have to learn how to deal with them. I have to kind of get the best medical care that I can find, so that, you know, I can live the best life with this condition. I guess that whole idea just never really sat right with me. Prior to becoming very sick, I was extremely active. I was doing really well. I mean, like, I probably on an average day was exercising or doing something active for 4 to 5 hours a day. I was a rock climber. I was very strong physically. I would go on hikes that, you know, were up to 20 plus miles. I would hike all around the mountains with like a 20-pound rock climbing crash pad on my back, like at high elevations. So I guess just like the idea of like me going from this really active person to being very sick, like I've always thought that like if I could be that well and get that sick that fast, like why couldn't I get better? Like why should I lose hope of like becoming better? And like this, and guys, this is my perspective, my thoughts. Like I'm not saying that I'm right, I'm not saying that if people think differently that they're wrong, but these are just my personal thoughts on my own journey. I don't know, just an idea of like this incurable connective tissue disorder for me. Like I don't know. I mean, I fit all the diagnostic criteria for HEDS. I have so many of the comorbid conditions of EDS that it's almost crazy to think that I don't have it. But as I have learned more about chronic Lyme disease and other chronic infections that act similarly, I just have come more to believe that with my own story, Lyme disease fits better than HEDS. And so it's not really to say that I know I don't have HEDS. I fit all the diagnostic criteria currently, but it turns out that chronic infections can affect any system of your body, just like EDS, including connective tissue. To me, just like the idea of an infection making me this sick makes more sense in my own situation. And so I've kind of come to the point in my journey where I don't really feel like I need a specific label to say I have this condition, and because I was diagnosed, I can now feel validated in how sick I am, which I know is a big deal. And for me, it was a big deal, like getting different diagnoses. Like it did help me to feel validated on how debilitated I've been with these symptoms and continue to be. But I've come to a point in my journey where I'm like, I don't even care what you call it. Like, I am sick. I was this one way, and now I am in a very different situation than I was in 5 years ago. I guess, like, for me, the answer to the question of this video, do I actually have EDS? I don't know. And my honest opinion, and like anybody that has HEDS, I don't think anybody knows, like, for sure. And that doesn't mean that your illness isn't valid. That doesn't mean that your symptoms aren't valid. I mean, I have so many friends that have HEDS and have seen just the devastating effects of these diseases and what they can do to people. I mean, it can be completely debilitating and disabling, and just cause unimaginable symptoms. And I would never ever downplay that or discount that in any way. But I think the point of this video is just to say that I don't know. I don't know if I have a genetic condition called HEDS. I fit the requirements that they currently are clinically diagnosing people with, but I do feel like the chronic Lyme disease and Bartonella fit more with my story, and make more sense to me. You'll see that I haven't really posted much about EDS. Typically I'll mention, you know, Lyme disease and Chiari and craniocervical instability or dysautonomia and things like that, but I often don't bring up EDS anymore. Just as I've researched chronic infections more and come to learn more about them, I wonder how many people with HEDS might have chronic infections. Now, again, I'm not telling anybody that they have any specific thing or condition. These are just my thoughts and things that I wonder, and I really, really hope that they will do more research on this in the future, because it's a big deal and these conditions are very serious. They're seriously affecting the lives of a lot of people. And to me, it just scares me how little is known about these conditions. I think if I had been treated for Lyme disease earlier on, I think it's possible that I would not have gotten as sick as I have gotten, and that my journey might have looked a lot different. But I believe that God has put me in this situation for a reason, and I have learned a lot and grown a lot during my chronic illness journey, and I'm really thankful for all the people that I have met along the way, and I know that I wouldn't have met otherwise. Anyways, I guess, I don't know, I just kind of wanted to share that with you guys because it is a question that I have been asked quite a few times, and I thought it deserved a video of its own because this is something that I think about a lot. I just really wonder what the connection with chronic infections and HEDS might be. I personally have a hunch that there's a big connection, but again, my opinion really doesn't mean much. So like I said, please take anything I say with a grain of salt, because I'm not a medical professional in any way. I'm just a patient that has been sick for several years and done a lot of research. I have been focused on Lyme disease treatment for the last year plus, and pretty much the only doctors that I have been seeing have been my Lyme disease doctor and a Chinese medicine doctor. So my approach for chronic illness has completely changed over the last year and a half, and I feel like we're on the right path. Everybody's different. I'm all for any treatment that helps someone, that makes someone feel better. Like, that's all I want for you guys, is for you guys to feel better. So I guess I just don't really feel like I need a specific label. I've come to that point in my journey where, you know, I know what I've been through. I know how sick I've been. I don't really feel like I need to have a label for that. And I know that, you know, having a diagnosis of EDS can be helpful for seeing doctors and how they treat you and how they approach treatments, because we often tend to be more fragile and more sensitive than the typical person. I still feel like I fit that category. And one thing that I kind of wonder is, like, do I have some sort of genetic predisposition to becoming more sick from something like Lyme disease or Bartonella? I think genetics do have a play in it, for sure, in my case, but I also think that, like, for me, I think that healing is possible, and that's what I am hoping for and doing my best to try to find. But I just think it's scary how little is known about HEDS and also chronic Lyme disease and chronic infections and their connections with all these other chronic illnesses that have become more prevalent recently. And so I look forward to more research hopefully being done, and especially in relation to the HEDS, because I think that would be interesting if there was a true connection that was found. I have heard of a few people that have improved craniocervical instability with their Lyme disease treatment. I think that's awesome. I hope that more cases like that will continue. Things like Chiari malformation and tethered cord syndrome, I wonder if there's a connection with Lyme disease and infections. I mean, it's crazy what chronic infections can do to a body. So I don't want to limit and say it's not possible that those conditions could be connected to or caused by a chronic infection, but of course I have no idea. These are just questions that I wonder about. I've also had several people reach out to me asking, like, how did you know if you had Lyme disease? And what should I do if I think it could be possible that I have it? I do plan on making a video going more into detail of that, but there is a book that I would recommend called Chronic by Dr. Stephen Phillips that really goes into chronic infections and how they can relate to autoimmune diseases. And I'll put a link to that book in the description down there if you want to check it out. That has been one of the most interesting books to me. So do I have HEDS? I don't know. At this point in my journey, it doesn't matter so much to me whether I do or do not have it. I would be interested if they do find that find a certain gene for some HEDS patients. I'd be interested to know if I had it, but right now I'm focused on treatment for my chronic infections, and I really hope that they will help me get better. So yeah, I will continue to bring you guys along on the journey, and if there's anything that you want me to make a video about or discuss, I will try my best to get to it. I hope that this video came across okay. I really try to not say anything that might come across wrong or hurt anyone's feelings. Just my opinion. You can take it in any way you want. Wishing you all the best. I'll look forward to seeing you guys next time.